Every employee from every major healthcare provider in Madison is now required to get the COVID vaccine or face losing their job. Unity Point Meritor became the latest to issue a mandate today, joining a long list of employers already mandating the vaccine, including SSM Health weeks ago, and UW Health made that same announcement yesterday. Now, here's a look at the current vaccination rates for those three healthcare systems. SSM Health says 80% of staff vaccinated. UW Health, 90% vaccinated. Meritor has about 80% of staff vaccinated. Now, that is a higher number than we showed you at 5 p.m. for Meritor because the rate drops to 62% across all of Unity Point's health coverage area in Illinois and Iowa. Adam Duxter has been tracking these requirements for us all week and joins us with how this happened so quickly. Adam?
Well, it certainly did happen fast, with nearly a half dozen mandates for healthcare workers throughout the state coming in just the last 48 hours. And depending on what happens over the course of the next month, your work might just be next in line to require the vaccine. 24 hours after UW Health became the second healthcare system in Madison to mandate a COVID vaccine for its staff, Unity Point Meritor became the third and largest system to follow suit. For Wisconsin Medical Society CEO Dr. Bud Chumbley, it's a response to a direct request.
I think there was a lot of hope out there that they might get by without mandates, but the Delta, I think, changed all that.
In the last 2 weeks, new cases of COVID, along with severe illness and hospitalizations, have surged, almost entirely with unvaccinated people. And while thousands of local healthcare workers remain unvaccinated, Chumbley says healthcare systems had one major concern.
They had to worry about having enough, people to care for the patients.
Dr. Chumbley says as long as an emergency use authorization remains, they're prepared for employees to quit or sue ahead of the requirement date.
That's the $64 million question: is what's going to happen when we hit that that date. You can sue anybody for anything, anytime, and I think they could do that.
Ultimately, he says it's about healthcare workers continuing to do the right thing and leading by example.
Sometimes you'll hear people say, well, we didn't sign on for this, but really they did sign on for this. When you go into healthcare, you sign on to take care and protect your patients.
Dr. Chumbley and many others predict the FDA could fully authorize Pfizer's vaccine early next month, meaning the vaccine will have full clearance and approval. And he says when that happens, you can expect more workplaces and schools to require their employees or their students to get the shot.